Welcome all. Question for the day. Why colchicine is used in acute gout? We all know the pathology of gout, that there is increase in the uric acid crystals, so which is called hyperuricemia. In case of acute gout, what happens? In acute gout, those increased uric acid crystals will enters into the joint. So when it enters into the joint, it will be taken up by the synovial cells. So once the synovial cells takes up this uric acid crystals, it will release some chemotactic substances to attract the neutrophil. So this process is called as granulocyte migration or neutrophil migration. Now what happens? Those neutrophils will engulf this uric acid crystals, which in turn leads to glycoprotein production. And this glycoproteins has two important functions. One is lactic acid production, and second thing is it stimulates the release of lysosomal enzymes. Now what is the importance of these two? When lactic acid production occurs, what happens? The medium becomes acidic, so uric acid crystals will remain insoluble in an acidic medium, so which in turn gets precipitated and it will affect the joint tissue, so which in turn leads to inflammation. In case if lysosomal enzyme is released, what happens? It will directly affect the joint tissues, which in turn leads to pain and inflammation. So this is the pathology in acute gout. Now if we give colchicine, what happens? Colchicine, it will go and inhibit this granulocyte migration or neutrophil migration, first mechanism. Second mechanism, it will inhibit this glycoprotein production. So no lactic acid production occurs, no release of lysosomal enzyme. So no inflammation of the joints. So this is the second mechanism. Thirdly, it will also affect the mitotic spindle in the neutrophil. When mitotic spindle affects, what happens? There will be decrease in the multiplication of neutrophils, or it will inhibit the neutrophil multiplication. So which in turn, there will be decreased inflammations of the joint. So these are the three important reasons why we give colchicine in acute gout. Thank you.